All right, let's get right into it. We're going to talk about a cancer drug that's incredibly effective. I mean, it's a real game changer for people with prostate cancer. But, and this is a big but, it comes with a hidden danger, one that actually gets worse the longer you take it.
I mean, just think about that for a second. You've got this treatment that's keeping you healthy, protecting your body, but every single dose is like ticking a clock, pushing the odds of a really serious complication higher and higher. Well, that's not a hypothetical. It's the exact dilemma at the heart of a brand new study.
So, to really get why this drug is such a big deal, we first need to understand the enemy it's designed to fight. See, when advanced prostate cancer starts to spread, it often loves to go to the bones. And this is a huge problem. It's not just that the cancer's there, it literally weakens your skeleton. This can lead to what doctors call skeletal-related events. And that's a nice way of saying things like horrible, painful fractures, your spinal cord getting compressed, stuff that requires major interventions like surgery or radiation.
And this is where denosumab comes in. It's this incredible modern drug that basically acts like a force field for your bones. It's been shown to be even better than older drugs at stopping those awful skeletal events, which, is why it's become a go-to treatment over the last decade.
But here's the thing about a powerful shield. It can have a weak spot. And as patients have been on this drug for longer and longer, a really serious side effect has come into focus.
It's a mouthful, I know. MRONJ. It stands for medication-related osteonecrosis of the jaw, and it's pretty much as grim as it sounds. A piece of your jawbone actually dies. It becomes exposed right through your gums, and it just won't heal. And the craziest part? It can be triggered by something as simple as getting a tooth pulled.
And don't just take my word for how bad this is. The researchers behind this new study call it, and I'm quoting here, a potentially debilitating complication. I mean, it can totally wreck a person's quality of life, affecting how they eat, how they talk, everything.
For years, doctors knew MRONJ was a risk, but nobody really understood the true odds over the long haul. But now, wow, now we have a much clearer and honestly, a much more alarming picture.
So, a team in Japan did the biggest study of its kind. They looked back at the records of 624 men with prostate cancer who were all treated with denosumab, tracking them for years to see what really happens over time.
And this is where the findings are just jaw-dropping. Look at this. After 1 year on the drug, the risk is under 5%. Okay, not great, but maybe manageable. But then look at year 3. It jumps all the way to over 20%. That's 1 in 5 patients. And then you get to the 6-year mark.
51.9%. Let's just sit with that for a second. After 6 years of treatment, the chance of getting this awful jaw condition is literally a coin toss. This is huge. It's so much higher than what anyone thought based on the earlier shorter studies.
Okay, so the study didn't just drop that bombshell and walk away. They also dug in to figure out, who is most likely to have this happen to them.
Right? This is the million-dollar question for any doctor or patient trying to make a decision. What are the red flags we should be looking for?
Well, the analysis found 3 big independent risk factors. First, if the cancer had spread all over your bones, not just in a few spots, your risk basically doubled. Second, if you were also taking common blood thinners, risk doubled again. And finally, and this one is really key, if you had any major dental work done recently, that more than doubled your risk.
But just when this all starts to sound like really bad news, the study uncovers something incredibly hopeful. A simple change that might just cut this terrible risk in half.
It all comes down to timing. So the standard way to give this drug is a shot every single month. But the researchers noticed that some patients were getting their shots spaced further apart, so more than a month between doses. And guess what? Those patients had their risk of MRONJ slashed by about 50%.
Of course, this is the first thing you'd ask, right? Okay, it's safer, but does it still work? Is spacing out the doses leaving the bones unprotected? A safer drug is useless if it stops doing its main job.
And here is the absolute best part. The answer was no. The researchers found no real difference in how well the drug worked. The patients with the spaced-out doses were just as protected from fractures and other bone problems as the ones getting monthly shots. This is the whole ballgame, a safer strategy that seems to be just as effective.
So we end on this really powerful idea. Maybe for these long-term treatments, one-size-fits-all is the wrong way to think. This study suggests that by looking at a patient's risk factors and just adjusting their dosing schedule, we can keep all the incredible benefits of a drug like denosumab while massively cutting down on the harm. It's a huge step towards smarter, more personalized, and ultimately much safer cancer care.